Welcome back to the London Futurist Podcast. Our topic in this episode is progress with ending aging. Our guest is the person who literally wrote the book on that subject, namely the book Ending Aging, the Rejuvenation Breakthroughs that Could Reverse Human Aging in Our Lifetime. He is Aubrey de Grey, who describes himself in his Twitter biography as spearheading the global crusade to defeat aging. In pursuit of that objective, Aubrey co-founded the Methuselah Foundation in 2003, the SENS Research Foundation in 2009, and the LEV Foundation, that is the Longevity Escape Velocity Foundation, in 2022, where he serves as President and Chief Science Officer. Full disclosure, I myself also have a role on the executive management team of LEV Foundation, but today I'm wearing my hat as co-host of the London Futurists Podcast. Aubrey, welcome back to the show.
Well, thanks for having me again, David.
Thanks for joining us again, Aubrey.
Yeah, thanks, Callum.
Aubrey, when I talk to people about ending aging, they often say the idea sounds nice, but they say they see no evidence for any actual progress toward ending aging in humans. They say that they've heard talk about that subject for years or even decades, but wonder when all that talk is going to result in people actually living significantly longer. How do you respond?
Honestly, I'm quite sympathetic to that reaction from people outside the field, because in order to make any kind of estimate of how likely it is that we will achieve some future technological goal, or indeed how soon we will achieve it, one has to have a pretty deep understanding of where we currently are, what's left to put into place. From the outside, it would have been completely impossible for anybody to evaluate how soon powered flight would have been achieved in 1900, for example. Indeed, it was not terribly effective for people who were in the field, who were actually professional physicists. Then again, of course, one could also argue the other way. One could say, well, Leonardo da Vinci was a pretty good physicist, and he probably was over-optimistic with regard to how soon his designs for powered flight would come to fruition. So one can't tell for sure. Absolutely one can't. But the people who have the best chance of estimating the time frame for achieving some pioneering technological achievement are the people who know the most about the fine detail. And as such, in a sense, what I'm doing when I give predictions of that is I'm simply asking people to trust my expertise. But hey, that's what experts are supposed to do.
What are the bases in which you form your opinion that perhaps we can reverse human aging in the lifetimes of many people alive now?
The first aspect of that is the overall SENS philosophy, the overall idea of a divide and conquer, damage repair approach to bringing aging under medical control. Before that was put in place in the year 2000, there really wasn't a plan. Nobody had any idea how we might defeat aging. And as such, it really was impossible, even for experts, to give any estimate of how soon we would do it. But once we had a plan, first of all, this overarching philosophy of a divide and conquer damage repair approach, and secondly, the components of that approach in terms of concrete proposals for technologies that would actually do the repair of different types of damage. Once we had that, one could look at each of those components and say, well, okay, how difficult is this? How close are we already? How much have we already put in place in terms of technology that already exists? How much needs to be improved upon? Of course, it's still pretty subjective to put all of that together and aggregate it into a single estimate for how long it's all going to take, but it's a lot better than trying to guess without having that information.
For those of our listeners who aren't familiar with this, it might be worth just giving a quick recap of what the SENS approach is. Way back 20-odd years ago, you pioneered the idea that there are an identified and identifiable number of things that go wrong with our bodies at the cellular level. And we know at a high level what they are, and we know at a high level how to fix them. Of course, the devil is in the detail. And then there was a paper in 2014, I think, called The Hallmarks of Aging, which picked up that idea and developed it. And it's now become mainstream, hasn't it? This idea, which was revolutionary when you first proposed it.
Yeah, that's more or less correct. I mean, let's be clear. First of all, there are huge numbers of types of damage in the body, and we are identifying more and more of them all the time. So what I did in 2000 is I identified a manageable number of categories into which those types of damage could be partitioned. And the value of doing so was that for each category, I identified a corresponding damage repair paradigm, a kind of generic approach to fixing all of the examples within the category. So that meant that so long as the classification remained solid, in other words, things did not turn up that didn't fit into the classification, we had a solid plan. Of course, even within a given category, the different examples will need somewhat different treatments to repair them, but they will only be somewhat different. There will be a great deal in common between the treatments that are used for things within a given category, like, for example, stem cell therapies for all types of cell loss. That's just one example. Now, the Hallmarks of Aging paper that you mentioned, actually 2013 to be more precise, it did indeed put an end to any controversy about the scientific validity of the damage repair approach, which had been a bit of a running battle for me over the previous decade, though honestly by about 2008 it was completely over, and it was really a case of a few years for the dust to settle, because some of it was a bit acrimonious, before people could come out and publish a paper like the Hallmarks. The one thing that I felt was missing from the Hallmarks paper in 2013 that was really important was this correspondence between damage categories and repair approaches. Well, there were other things missing, whole chunks of the original classification that just weren't there, and that's been somewhat remedied in more recent updates to it. But I felt that really one's missing the point unless one has this correspondence, because otherwise it's just a catalogue. There was some lip service to that in those papers, but I think it is worth highlighting that we need to really have that front and centre.
So where are we with the different approaches to the various categories? I understand back in about 2000 you had the 7 types of damage and 7 approaches, one for each type. Has that moved on since then? Are you still pursuing the 7 lines?
Yeah, so 3 pieces of good news. First piece of good news is that the classification has indeed stood the test of time. There's basically nothing that's come along that really is outside of the categories. Well, there's one example that I like to highlight, which is the closing up of a bony structure in the skull called the cribriform plate, for which there is now fairly good evidence for contribution to Alzheimer's disease. And there are people working on reversing that. I can't put my hand on my heart and say that that naturally fits into any of the original 7 categories, but it's the only example. And it's not a problematic one because, as I say, we seem to have a way to fix it. So that's good. Second piece of good news is that the various approaches that I put forward in 2000 or so have all moved forward quite a lot. In fact, every one of them is now at one level or another being pursued in the private sector. So in other words, the technology has moved forward far enough that at least some more courageous investors believe that it is within striking distance of generating actual revenue, which is very handy. And the third piece of good news is that for every single one of these 7 categories, there are now multiple different approaches, not just one. Alternative ways of achieving the repair of the damage in question that are just as generic as the original one. And so even if the original ones somehow founder or run into the sand one way or another in certain cases, we've still got plan B in each case.
And one of the reasons why there is now research being paid for by the private sector into all of the various ways of treating the different forms of damage is that our technology is giving us better and better tools to address them. And obviously, information processing is one of our best tools. Has the arrival of transformer technology and generative AI, has that given the whole sector a kick in a noticeable way?
It has. It's a little bit early days for most of the stuff that I tend to focus on. So let me go into a little bit of detail here. Where the enormous breakthroughs of the past decade or more in machine learning have had the greatest impact in the development of medicines has been in the pharmacological level, in the identification of drugs, new drugs, or repurposing of existing drugs that have impacts that had not previously been identified or were difficult to identify. This has come in various guises, and in particular, the key thing to bear in mind is it's by no means specific to aging. Perhaps the single most conspicuous example is AlphaFold, the program developed by DeepMind that identifies the three-dimensional structure of a protein starting from its amino acid sequence. This is a breakthrough in a very old classical problem of computer science. It's fantastic. But the key thing is that it now enables a great deal of streamlining and acceleration of drug discovery across the board, whether in aging or in anything else. So in that sense, it's an enabling technology very much like the sequencing of the human genome 20 years ago or more. Now, outside of that, we can certainly envisage a lot more here. And in particular, we can envisage a great deal more progress arising from the analysis of datasets from people of different ages. The most important of all is datasets that are longitudinal, where the same person has been studied over a long period of time. So one of the biggest barriers right now that I want to see overcome as quickly as possible is the proprietary and or confidential nature of such data. There's huge warehouses of such data in people's vaults that are, for whatever reason, unavailable for this kind of analysis. And the sooner that changes, the better.
We'll be right back after a quick break.
Welcome to Inspiring Computing. This podcast is where computing meets the real world. Inspiring Computing aims to trigger your curiosity by talking to proficient and advanced MATLAB, Python, and Julia users who use these tools to deepen their understanding of the world around them by simulating it, exploring trade-offs, and gaining insights that help their companies add more value. In addition to proficient users, we will be talking to product marketing, toolbox authors, package developers, and library maintainers to see what drives their development and what issues they're solving for others to benefit from.
So in terms of data that might shed new light on what's going on with aging and interventions, I think this is probably the time to ask you about the RMR project, Robust Mouse Rejuvenation, which will be generating, and is generating already, I think, since February last year, some data that could be very significant. Could you talk to us about that?
Yes, absolutely. And it starts by going back to this whole idea that damage repair is a divide and conquer strategy, where you've got to have different interventions that repair different types of damage. Now, for the past 15 years or so, my focus, in fact more than 15 really, has been on addressing the most difficult types of damage, doing the early stage proof of concept work to get the damage repair of types of damage going, which nobody else was working on because they couldn't see how, or it was too difficult, or for whatever reason it was outside of the short-termist incentive structure that exists for different reasons in academia and in industry. That's obviously essential. You've got to get these components working. But equally essential for any divide and conquer strategy is to see what happens when you put the things together. You may get surprises. That applies for the easy examples, the easy types of damage repair, as well as for the most difficult ones. At LEV Foundation, our main focus is to do exactly that, to start the process of putting together things that already have modest benefits on certain types of damage. And of course, we are using the easiest ones because those are the ones that have been demonstrated to have benefit already, but actually working in mice rather than only in cell culture. So that's what we're doing. As you say, we started the first example of such an experiment in February of last year. Our goal here is to postpone the decline in mental and physical function of mice, and of course also to postpone their death. Key thing is we start late in life, not all that late, not when they're already sick and most of them have already died or anything, but when they're in middle age. So for the strain of mice we're using, C57 Black 6, that means a year and a half old, because these mice on average live to about 2.5 years.
Now, 1.5 years into a 2.5 year lifespan, did you say? So what's that in human terms, roughly?
Well, if you think about the average human lifespan of 80 years, and these mice live on average to 2.5, 80 divided by 2.5 is 32. 1.5 times 32 is 48. So the equivalent is starting about then. So then the question is, what are we trying to achieve? Well, of course, we're trying to find things out. We're trying to identify which of the interventions work better than others, and especially which of them work better than others in combination. We have 4 interventions that we are testing. We obviously have a control group that's getting none of them and a group that's getting all 4. But we also have baseline groups that are getting just one of them, largely to validate that we're doing the intervention well. Effectively, we're recapitulating the work done by other groups that identified that the interventions were worth trying in the first place. And we've also got treatment groups that are getting 3 out of the 4 interventions. This is very important in order to highlight and reveal any antagonistic interactions that we may not have expected, whereby 2 interventions will in some way cancel each other out. Now, the interventions also have been chosen to be very different from each other, in other words, to target different sets of damage. And the experiment is ongoing. As you say, we started something over a year ago, which means that the mice have now reached and gone somewhat beyond their normal average lifespan. And I'm pleased to say that the treatment groups that are getting all of the things, or most of the ones that are getting 3 of the things, are still mostly alive. So in other words, the overall experiment is working. The control groups are more than half dead, but only slightly more than half. So it's not as if we are in any way simplifying or exaggerating the effect. So yeah, everything's going as well as it possibly could at this point. But the key thing I want to highlight is that this is just the first such experiment. Nobody else in the world is doing experiments anything like this, even though they recognize that these experiments are immensely valuable. Here's the problem. The experiment is, first of all, very expensive. It costs $3.5 million to get going, and most of that cost is upfront. Secondly, we want to combine things, and that's somehow antithetical to the incentive structure within academia, or within industry for that matter, where they're tending to want to either make money or get publications focused on particular hypotheses or particular products. And thirdly, one thing that makes the experiment so expensive and challenging is that we are not restricting ourselves to things that can be supplied in the chow, so applied orally, which is much less expensive, of course, than injecting things. 3 of our things are injected. That's really important to do because you can't supply gene therapies or cell therapies orally. And these are going to be absolutely vital for getting really dramatic results. So what we'd like to do is bring in the money to be able to do a lot more experiments like this. The second experiment that we want to do is absolutely planned, and it's described prominently on the LEV Foundation website. But we have to raise another $3.5 million to do it. And that's not trivial.
So what's going to make people decide that this is worth supporting?
Well, of course, in order to write a check for any kind of work in this space, one first of all has to believe in the longevity mission, and that's hard enough work. I spend most of my life trying to help that happen. Secondly, they've got to understand the unique nature of the work we're doing. The reason I've gone into some detail over the past 10 minutes in describing the rationale for this work and the reasons why other people are not doing it is so as to dispel any assumption that people might have that the reason people are not doing it is because it's actually not a very good idea. And of course, it would be nice to go further than that, and I'm certainly happy, very happy, that a number of luminaries in the field have said very positive things about this particular line of research. I intend to accumulate quite a few more such endorsements so as to encourage more people to help.
Do you have a goal that you set yourself, the outcome from the RMR study that you're looking for? I know there's lots of different treatments that are being applied, which is kind of the whole point, and different combinations, that the average of the most promising treatment mouse lives 5% longer, 10% longer, or is it just as long as there's a statistically valid improvement, that's good enough?
I definitely have a goal. I think that the purpose of this work is twofold. One is to identify interventions that have a chance of translating to humans, perhaps not translating simplistically, but giving us a clue about how to build a human intervention. And the second one is, let me call it rhetorical. In other words, I'm interested in getting a result that's dramatic enough to move the needle of public opinion and public policy. I believe that what that needs is a good deal more than statistical significance. The milestone that I have set, which I call robust mouse rejuvenation, is to double the remaining average lifespan of these mice. So as I say, we start when the mice are about 1 year shy of their average lifespan, so 1.5 years old when their average is 2.5. And I'd like to get the average out to 3.5. I'd also like to extend the maximum lifespan by a similar amount. So with the number of mice that we're using, we would expect that the oldest mice in a given group will typically live maybe 9 months longer than the average. So we'd hope to get that same 9 months in the longest lived group that are getting all the treatments. Now, the reason I've set that particular goal of adding a year on both mean and maximum lifespan, starting in middle age, is because I believe that the key thing that we need to do in order to move the needle of public opinion and public policy is to have the majority of my colleagues in the field who are expert luminaries who make public pronouncements, the majority of them saying, you know what, this really proves that we are within striking distance of bringing aging under comprehensive medical control. That is something that they are not willing to say yet, only a bit elliptically anyway, or for marketing purposes. They're not willing to say it in the way that they would say other things in scientific papers. So I want to achieve that. And of course, there aren't many of those people. There's half a dozen of us, and we know each other very well. We're all good friends. So I have a very accurate idea of how dramatic progress needs to be in order to, if you like, make these people feel they have permission to be gung-ho in public. And I believe that that's a pretty good estimate of what we want to achieve. I actually become more optimistic about this over the years. So I first started talking about this concept of robust mouse rejuvenation 20 years ago. And back then, the threshold that I gave was more extreme. I said, first of all, we've got to start not only with a fairly long-lived strain like Black 6, we've got to start with a really long-lived strain that has an average lifespan of 3 years, not 2.5. That's difficult in the first place. And then we've got to start at 2 years, and we've got to treble the remaining lifespan. I said we've got to go from 3 out to 5. And I said all that because I believed at that point that my colleagues in the field, my fellow luminaries, needed that level of drama in order to go public with optimistic statements. But as time's gone on, the climate, the general mood of the public and of the media and so on in this field has improved so much that I believe a substantially less dramatic amount of progress of the sort I've just described would be enough to give this permission.
Talking about what the other luminaries and key researchers in this field think, many of them will be gathered with you at the Longevity Summit Dublin from the 13th to the 16th of June this year, when it'll be the third such annual gathering. I've got a couple of questions for you about that. Do you think this is going to be significantly different this third time from the two previous such gatherings? And some people ask me, why should they go to this event in Dublin when there's maybe half a dozen other sort of similar longevity events as they see it taking place in other parts of the world?
So will it be different? Well, of course, every conference is different, but there's a reason why we have these conferences every year, in contrast to the situation a decade ago when I was running conferences in Cambridge and I only had them every alternate year. The reason is very straightforward. Progress is a lot faster now than it used to be. Last year, I was able to describe the experiment that we were a few months into. This year, we're going to be able to talk about the actual results, not the complete results, of course, because the experiment, I'm very pleased to say, is not yet complete. But Caitlin Lewis, my main scientist, will be giving the main talk describing where we are so far. And I'll be giving a similar talk in Copenhagen at another very prominent conference in the field. Honestly, people should go to as many of these conferences as they can, because so much is happening and you can't have every scientist that's doing useful stuff speaking at every meeting. I go to as many of them as I can, but people who are not in the field or people who are not doing the actual work, that applies even more. As regards what makes Dublin particularly special, a lot of it is the structure of the conference. I've run my conferences since way back in 2003 with a very strong emphasis on the networking aspect, on the socializing, because so much happens at conferences that is unpredicted, unscheduled. There's a reason I have free alcohol every evening at the bar, because it keeps people talking. and it really, really delivers. Another thing that makes Dublin unique is that I'm very careful every year to have a big mix of the top names in the field who always have new stuff to say, and people that you won't have heard of if you're just going to other conferences. People who are either newcomers to the field or who might not be regarded as in the longevity field at all, might not even regard themselves as being in the longevity field, but whose technology that they can report on is something that I have seen has great relevance. Again, I've done this many times over many years, brought people in who ask me, why are you inviting me? And they come and lo and behold, they find out why they've been invited because they form collaborations. Everyone understands the relevance after they've given their talk. And there's a lot more of that in Dublin than there is at any other conference.
I attended last year's and I was really struck by a couple of things. One was the consistently high level of the quality of the presentations. I go to a lot of conferences and very often the quality is quite variable. There's a few very good ones and there's quite a lot which are not so good. And at Dublin, just about everybody was riveting. And the other was just how many different ways people are trying at tackling aging. It's inevitable since there are all these different categories of malfunction that happen that you're going to need a lot of different approaches to fix them, but loads and loads of different approaches. But the question I wanted to ask you is, I'm sure that you'll have got pushback from people saying, well, it's all very well showing that these therapies work in mice, but we're not mice. They're a pretty good model, but human biology is quite different from mouse biology. How do you persuade people that the bridge is jumpable?
In terms of the Dublin conference, I persuade people of that in the obvious way, namely quite a lot of the speakers, typically at least a quarter of them, are reporting on clinical trials. And certainly some of the most impressive ones and most eye-catching talks are of that nature.
Clinical trials involving humans.
That's right. That's the definition of clinical versus preclinical. For example, there was a fantastic talk last year by Vlad Vitok from Myad Biotechnology, which is working on my current favorite cancer therapy, and showed absolutely mind-blowing results. At least a quarter of the talks at every Dublin conference are of that nature. Outside of the conference, I am always looking to understand how the translation will happen. Everyone knows that the translation of pharmaceuticals from mice to people has a very low hit rate, but people still do mouse experiments because if something works in mice, it's more likely to work in humans than it is if it doesn't work in mice. And the thing is that damage repair, there's good intuitive reasons to suppose that, in general, damage repair interventions will have a higher translatability because the nature of the damage is very similar. You're not, if you like, messing with the black box of metabolism that obviously is very different in one species versus another.
One approach to demonstrating rejuvenation in humans is something you were involved with last year, which was the formulation of a huge prize, $101 million set aside for winners of the X Prize Health Span Award. Could you tell us about that?
Sure can, yes. In fact, I've been involved for a very great deal longer than a year in that. Peter Diamandis was a good friend of my co-founder of the Methuselah Foundation, Dave Goebel, back in the early 2000s. And in fact, so Peter, who of course founded the X Prize Foundation, was our first business advisor at Methuselah. I've known him all that time. And it must be since like 2006 that we've been discussing ways in which we could do some kind of longevity X Prize. But one thing that Peter has is an extremely good intuition for what constitutes a prize that will work. In other words, that will actually improve incentives. It's a balance between audacity and achievability, is how he likes to put it. It took until a few years ago to get to the point where that was really there. It had to be a prize for humans, not mice, and it had to be dramatic. As luck would have it, just at that same time, someone with a little bit of money to spend came along and was prepared to fund the design of such a prize, which is an extensive process.
Was that Sergey Young by any chance?
That was indeed Sergey Young, yes, originally. And Michael Antonov, a friend of his, friend of mine, came in to supplement what Sergey spent after a little while.
One of the co-founders of Oculus.
That's right. And then, of course, a strong supporter, donor to SENS Research Foundation and so on. Sergey and then Michael were able to bankroll the design process, which started, I'm going to say, in like 2017 or 18. I ended up basically leading the scientific side of that as their main scientific consultant. So the prize is, well, you can look at the rules and you'll see my fingerprints all over it. I'm very happy with how the thing turned out. It's very much a rejuvenation prize, a damage repair prize. And yes, I'm still a scientific advisor to the X Prize on this. I am absolutely overjoyed that they were able to recruit Jamie Justice as the lead executive director of that prize. She's a spectacular scientist. I've known her in that capacity for a long time. And she has blown me away with how good she is at all the other aspects of what's required to lead a prize like this. So it's going absolutely wonderfully at this point.
So I remember, to win the prize, you have to be able to demonstrate by 2030 a set of treatments which, administered over the course of a year to somebody in their 50s, would reverse by up to 10 years some measurements of the vitality of their immune system, their muscle system, and also their brain. That seems like a tall order. How likely is it, do you think, that the prize will be won, and what factors might influence how likely it is that the prize is won?
Yeah, you're absolutely right. It's a very tall order. And in fact, the prize has been defined a little bit more ambitiously than that by saying that if you get to 10 years, you get all but 20 million of the prize. If you get to 15 years, you get all but 10 million. You only get the actual total of 101 million if you get to 20 years of rejuvenation. Furthermore, as you said, it has to be in all three of these categories. And the methods by which biological age in these categories is going to be required to be measured will be at the level of function, not at the level of epigenetic clocks or whatever, though, of course, there's no harm in that. But we're very much focusing on function as the requirement. So yes, it's a very tall order. Now, it's not inconceivable that we will get to 2030 without much progress happening, and there will be a decision to extend the prize. That has happened with previous X Prizes, like the Lunar X Prize. But equally, it's not out of the question that progress will be so rapid that the prize gets abandoned in the way that the Genomics X Prize did, because it was no longer actually needed in order to provide incentives for progress. Either of those outcomes would be fine, though, of course, the latter outcome would be the best of all. So, yeah, we just don't know what's going to happen. And that's, of course, the beauty of these prizes. It really does provide incentives.
And is the prize already generating significant new research, which wasn't happening before? And is it bringing big players in who've got very deep pockets?
It's a bit too early to say. The prize was only officially announced in November, so we're only talking like 5 or 6 months ago. There are hundreds of teams that have registered initial intent. Now, the way that this is done, and this is, again, stuff that's been learned by the X Prize Foundation from previous prizes that were not biomedical necessarily, a lot of teams will simply not really have any idea how to proceed, and they'll be weeded out pretty quickly. There's a process, I forget the exact dates, but the process whereby fairly soon a set of teams that have realistic-looking applications will be given a small amount of money from the pot to help them along, so to speak. And then there's a second similar weeding out filtration process that happens a year thereafter that. You're allowed to come in late as a competitor and register your interest, but if you do, then eventually you have to pay extra just to get in at all. So it's all optimized to incentivize high quality and high energy teams. The people who will be actually paying for this, that's going to be a very interesting aspect of that, which, as I say, it's too early to say what's really going to happen. But certainly, dating back right to the original X Prize for space tourism, we have seen people with very deep pockets taking the view that winning the prize will do a great deal more than earning them the prize pot. It will also earn them prestige that will create a business situation whereby they can make a great deal of money thereafter. And of course, the market for things that rejuvenate people by 10 or 20 years is quite a lot larger than the market for space tourism. So I can certainly see a lot of people with very deep pockets getting involved.
Can we foresee that in Dublin there will be groups of people getting together, perhaps in free alcohol sessions, and saying, I have this idea, I've seen this talk, and somebody else will say, well, funnily enough, I had a similar idea. and that may be the genesis of a team that goes on to fare well in the X Prize.
I wouldn't be at all surprised. That process is already gestating, I would say. We had Jamie Justice speak last year at the conference, even though it was before the official launch of the prize. She was only able to speak in somewhat general terms, but it definitely got excitement up. This year we have Peter Diamandis himself. So I certainly think that if there's anywhere where one could end up meeting people with whom one might collaborate on an entry to the prize, it's Dublin.
Of course, what would put real rocket boots on this whole sector is if the general population decided that it was plausible that their parents could live a lot longer and they themselves could live a lot longer. As that happens, then the pressure on politicians to stump up a great deal of money would become irresistible. I don't see any sign of that happening yet. When we spoke to you last time, you came up with this great idea. I think you came up with this great idea of longevity singularity, which is when the majority of the population drop the aging trance and decide that radical longevity is possible and create lots of demand for money to be spent. I still find in my conversations with people who are not thinking about this day to day, they don't think it's possible. They're not even particularly attracted to the idea. Are you seeing any signs of the aging trance loosening its grip?
Not really, but that brings me back to the RMR experiments that we're doing. I somewhat over-abbreviated the rhetorical motivation for these experiments. I said, well, okay, what I want to do is have public pronouncements by my fellow luminaries be a lot more optimistic, and that will lead to a dramatic change in public policy. So let me fill in the gaps in that. The way that's going to happen is by two further intermediate steps. The first step being that when my fellow luminaries start saying this, opinion formers, the Oprah Winfreys of this world, are going to start saying it too. And that is going to change public opinion because, for whatever reason, people do what Oprah tells them to. And as soon as public opinion changes, as you say, public policy will follow suit because politicians have one singular goal in life, which is to get re-elected. So yes, that's the way I'm seeing it happen. And that means that I'm not particularly despondent about the fact that it hasn't happened much yet. And I think that we're on the right track to make it happen as soon as possible.
One approach to try and help people throw off the aging trance, I think that was the phrase, is the Dublin Longevity Declaration, in which a number of anti-aging researchers, along with lots of members of the general public, have already expressed their views as to the desirability of this transformation, the desirability of lots more funding. Is that project still going on, the Dublin Longevity Declaration?
Very much so. So, yes, the declaration is called the Dublin Longevity Declaration because I and Brian Kennedy and Martin O'Dea, who were the people who essentially put it together, announced it at the last Dublin conference. And as you say, yes, well over 100 luminaries in the field have signed up to it, and a few thousand members of the general public have done so. Now, you may ask, okay, what's this for? It's not just to declare the desirability of the comprehensive medical control of aging. It was also very much to declare the feasibility. In other words, it was a step towards the exact gung-ho pronouncements thing that I was talking about that I think will happen once we achieve robust mass rejuvenation. We are not yet at the position of being able to get luminaries to say the things that they really need to say to upend public opinion in the way that I was just describing. But we're a lot closer to it than we were 10 years ago. And that, of course, again, comes back to what I was saying about my having actually somewhat weakened the definition of RMR as what's going to be sufficient to get to the real result. So, yeah, this was just a demonstration of that. Before then, a lot of people that I would come across and discuss this with would be of the view that I was a real outlier in terms of how soon we may make good progress. I am certainly on the optimistic end of the spectrum, but I'm not 3 standard deviations away from the mean. I might be 1 standard deviation away. And the Dublin Longevity Declaration very much demonstrates that. So what I want to do is ensure that it gets much, much more exposure. One thing we'd certainly like to do is to get other biologists who are not necessarily working in the longevity field, especially very prominent ones who've won Nobel Prizes or Lasker Prizes or whatever, to sign up to this. And that is an ongoing campaign. The more that happens, I believe, the more people from the general public will sign up, and this will really gain momentum.
Is there any final message you'd like to have our listeners think about as they move away from this podcast?
The main messages that I would like to highlight are the ones that you have highlighted in your questions. Number one, that the experiments that we're doing at LEV Foundation are the most important experiments in the field right now, as measured by amount of information gained per dollar spent. Even though these experiments are very expensive, $3.5 million, the amount of information is huge. And so any help that anybody can give, however small, to getting the next experiment going would be an extremely good use of money. Second thing is the Longevity Summit Dublin, which happens, as you mentioned, on June the 13th to 16th this year, is going to be, as it always is, a spectacular and unique gathering of people outside the field and inside the field, biology experts, lay people. It's a spectacular event and nobody ever regrets going to it. And thirdly, the Dublin Longevity Declaration is something that needs more signatories.
Well, Dublin is a great city, always worth visiting, and I can say from personal experience that conference is highly worth going. Pretty much all of our listeners should hurry along there.
Thank you.
Thanks, everybody.